Welcome and thanks for viewing this video. I'd like to give you a brief overview of cancer and then specific details about radiation oncology and how we use radiation therapy to treat disease. Over the years, certain cancers have decreased while others have increased. For some locations, our control rates have increased significantly. We've done really well, while others, the control rates really are unchanged. Cancer starts in a specific organ or tissue. It'll grow locally most often and then spread to other parts of the body. For some cancers, such as breast cancer, lymph nodes may be the early warning sign of spread, while for others, such as prostate cancer, bone metastases is often your first hint of spread. Once you're diagnosed with cancer, you may see many different types of physicians. Surgeons and radiation oncologists, like myself, especially focus on control of the disease locally at the primary site where the cancer started. Others, medical oncologists specifically, focus on both the primary sites of disease and then controlling or preventing the appearance of disease in other parts of the body. Your tumor cells will start from this initial site and then will travel through the bloodstream. Chemotherapy is injected into the bloodstream and then also follows this same pathway, trying to find areas where tumor cells are accumulating or growing and destroy them at that location. Over the years, the therapies have become much more sophisticated. As far as chemotherapy, we've had increase in the number of chemotherapies, in the way that they're used, and in the ability to manage side effects. Radiation therapy has become more sophisticated, as has surgery. And further, we are now combining these. Radiation therapy combining with chemotherapy up front, then surgery, radiation therapy and chemotherapy, and then surgery. There's many different combinations of this. And over the years, we've honed this to find the very best chance for cure. Radiation therapy focuses on local control or tumor reduction. Our goal is either curing the disease, getting rid of it, or at least reducing pain or other symptoms you can have. Most patients we treat with external radiation. If you think of a chest X-ray, this is very similar. You have high-energy photons that pass through the body. When they're doing this, some are absorbed, and this is actually what kills tumor. The amount of radiation is a lot stronger with radiation oncology. It's about 5,000 times more radiation, and the energy is much, much stronger, 100 to 200 times stronger than in a chest X-ray. Well, basically, as this beam of radiation passes through the body, the energy is deposited in the cells. It interacts with the water. Again, we're mostly water. And what this does, it produces a chemical reaction with the water that then produces a hydroxyl radical that damages the DNA. The cancer cells are much less effective at repairing this DNA than normal cells, so they will tend to accumulate DNA damage, and then when they try to reproduce, they die. Or sometimes we produce so much damage, they die immediately. Obviously, radiation therapy can be very dangerous. The treatments have got to be very precisely designed and delivered so that the probability for controlling disease is very high while we're still protecting normal structures as much as possible. We protect normal structures by both shielding them and also allowing time between the individual treatments so that they can recover from damage from the day before. Most treatments will take 10 to 40 treatments total, once a day, taking 10 to 20 minutes per day. Depending upon where we're treating, we may use immobilization devices to help keep you stable during the 10 to 20 minutes of treatment. There are multiple stresses with the diagnosis of cancer. Everything from the initial diagnosis, selecting a treatment, going through the treatment, and then the follow-up phase. How did I do? Will I live? One of the stresses is normal anxiety about radiation therapy. Pretty much everybody's anxious about radiation. Our staff, myself, we recognize this. We've developed a warm and caring environment, but at the same time, it's a very highly technological environment. Texas Oncology is currently the newest center in the Central Texas area. The facility design, the state-of-the-art equipment and technology, and the staff combine to produce a positive environment. I don't believe you will find a better care or have a better personal experience anywhere. External radiation is used to treat tumors that are immediately adjacent to or infiltrating one or more structures. The goal is to control the disease while minimizing the side effects to these adjacent structures. We do this in two ways. One is by extreme precision in radiation delivery. We carefully target the tumor and then shape the beam so that as much normal tissue as possible is excluded. The other way we protect normal cells versus tumor cells is through fractionation. Basically, we start off with 2 cell populations, normal cells, cancer cells. The first day we give radiation, we kill a few normal cells, we kill a few cancer cells, but not many. We cause a lot of damage that's not fatal. We wait 24 hours, the normal cells repair the damage. The cancer cells repair some of the damage, but not all of it. So the second day, we've got weaker cancer cells. We give radiation the second day, we kill a few normal cells, we kill a lot more cancer cells. We wait 24 hours, the normal cells recover, cancer cells recover, but again, not as much. So the third day, they're even more susceptible to the radiation. We do this on and on and on, letting the normal cells recover while the cancer cells continue to become more and more susceptible to the radiation.